થેન્ક્સ. એટલે યુવરાજભાઈએ કીધું કે ઇન્સ્યોરન્સ પર કંઈક બોલવાનું છે. तो मैं विचारूँ ऐसा करेगा तो ऐसा होगा. एवरीबडी इज टीचिंग, नो, ऐसा करेगा तो ऐसा होगा, ऐसा करेगा तो ऐसा होगा, बट कैसा करेगा तो पैसा आएगा is not something I was asked. So of lately, correct me if I am wrong, because मैं जे समझूँ છે કે insurance agents are also equally in dilemma like we are. किसको रोबोट में पैसा मिलेगा, किसको रोबोट में पैसा नहीं मिलेगा is very dicey. So I'm sure there are a lot of people who high volume centers who are using robots and have insurance facilities. But there are a couple of things that I learned interacting with these insurance agents over the last couple of days for this talk. The most important take-home word for everybody who has a robot, who is intending to use a robot, is modern technology. That is the clause that you will need to have in your patient's insurance policy. Modern technology is the word. So, like you have laparoscopy in general surgery. Now, instead of utilizing the word robotic, the companies have shifted to modern technology. So, modern technology, what initially we used to understand when they said ki sir 50% milega. But 50% of not your robotic charges, 50% the company is assuring to the patient is from their Sum Insured. So if the patient has a 5 lakh policy and his policy, the instrument says 50% coverage, means the patient will only get 2,50,000 for your robotic surgery. So in case if your package is 2 lakh and plus if you charge a lakh of rupees, the patient is only going to get 2,50,000 rupees and rest the patient has to bear. Most of the private companies, what I learned, have now started including this as per their standard, and they have started hiking their premiums also. Initially, these private companies used to give 5 or 10% of the total sum insured. Now they have shifted to practically almost a lakh of rupees. In the government sector, New India is the only one that has now started. Rest will soon follow because of the GIPSA thing. But like I said, modern technology is the word most important. Patients, you have to identify, ask the patient if they have the clause of modern technology. If not, ask them when you come back, when you get your renewals done, ask them to put it. So I'm sure all high volume centers or all robotic centers should have their insurance desk asking people in terms of what your insurance has or not.